Hi, it's Dr. Janowski for Sonata Aesthetics. Today we're going to do a non-surgical nose job, as it's commonly called now, really, which is just fillers in the nose. It's become quite popular, especially among young women or folks that just, they're either not ready for a real surgical nose job, they don't want one, they're concerned about it, or they want to just see what things might look like if and when they get a surgical nose job. And the nice thing about the fillers is instant, it's easy, just takes a few minutes. We can do a lot of nice things for the nose. We can straighten the bumps that we see from the side view, we can lift the tip, we can improve asymmetry in the nose. So there's lots of things we can do. In this case, we just have a little bit of dropping of the tip, and she likes to see it a little bit higher and straighter. So if we lift the tip, it gets a little bit straighter. We've done this before, and it can last up to a year, but it's time to do it again. So she has a very, very small hump here, so we'll put a little bit above and below the hump and a little bit in the tip, and you'll see an instant result. So I would use Restylane Lift, which is a nice, strong, firm filler, also reversible, and with good technique, it's a safe treatment. I've never had a problem with it, and very high satisfaction rate. So I'll show you how that works. So we're going to start with putting a little bit of ice on the bridge of the nose there, so you can remove that. And I'm just using the standard 29 needle, and what we want to do, it doesn't hurt very much up here, patients really don't feel much, but we want to go straight down the midline until we get a little bit resistance from bone. And did you feel that? Yeah, very good. And that's how we know we're safe down there. There's not likely to be vessels down there. We're going to just keep it really just on the periosteum. We'll create a little bolus, and then we can massage that bolus. The nice thing about this product is you can really kind of just push it into place. So we can make sure that that's nice and straight there. Go a little bit higher, we'll go down. And then again, we'll just massage. Usually there's very little recovery here, maybe bruising, but often not. And I like to do the nose in 2 steps because it will settle and we want to touch it up. So that's part 1 there. So let's put some ice down here. And we'll get a little bit of lift in the tip. There's different ways to do this, but I'll show you how I do it. Okay. Okay, and so we just want to lift the tip, and so if we very quickly come up from below and move the needle to keep it safe, that one will make you tear a little bit, right?
Just a little bit.
That's the hardest one, but she did great. It's already lifting a little bit in the super tip. And then once again, we just mold and make it look the way we want it to look. A little bit more right here. Almost done with this part. Yeah. So if we look from the profile view, come over this way, see that's really nice and straight. She has a lifted tip. We could do just a little bit more in the tip to give it a little bit more lift. Here we go, real fast. Some people will use a cannula for the nose, and that's fine. Sometimes do that too.
My eyes are watering.
Yeah, that's fine. Everybody tears a little bit. It's like an automatic tear response. That looks pretty good. Let's have her take a look in the mirror there. And see, that's a nice lifted tip and straight. If she's happy.
Oh wow. Yeah, that looks a lot better.
Yeah. Good. And so that's kind of all there is to it. Just took a few minutes there. And as I said, it will settle a bit, so we tend to want to do this in 2 steps, and we'll save some product for that. So that's just a quick version of the non-surgical nose job.